Bismillah ar-Rahman ar-Rahim. Today, it will be an open discussion actually, open discussion regarding how you should proceed on with your part 1 preparation and how I am usually taking the courses. Okay, dear? So, first of all, now we are targeting discussing about this session for January especially because October is near about. So I'm not encouraging people to start from now just to jump on the October diet. So the best thing to start, best timing to start for January diet is from now. Okay, it's a very good timing. Okay, so first of all, just a few questions that frequently people are asking me. So that's why actually I want to record it and I want to upload it. If anybody asking me, I can send them the video. So the first question is that people are asking me that how many months you should have in your hand to have your full preparation. So the first answer is it depends on you. It differs from person to person, obviously, right? So it depends on how long you are working, how much time you can give for your study. So if you can give average like 6 to 8 hours every day, or if it is like 8 to 10 hours, that is better, then yes, you can say that 6 months to 8 months, it is a good timing for preparation, for a perfect preparation without any confusion. Okay. So this is the thing. Some people, they are telling that I have only 3 months in my hand, I have only 4 months in my hand. So is it possible for me to start study from now and I will appear after four months? Maximum, what I'm telling, 4 months actually you need it if you don't have really any liability, no responsibility, no family responsibility and no job. If like that and you can study like 16 to 18 hours a day, then yeah, 4 months is possible because it's not about studying only. You have to solve the questions also. Okay, so it's not that even if you are speedy study you are doing, the question solving will take your time because you have to read out the explanation, and without read out the explanation you don't understand how you should approach. So it will take time. So yes, some people, they are telling, giving Facebook status and some like advertisement within 2 months, within 3 months, you will have good preparation, full preparation. To their face, this is a total lie. Nobody can prepare for 2 to 3 months for MRCP part 1. Yes, someone, if they have really a good basic for medicine, okay, they are seeing patient regularly for last 2 to 3 years or more than that, they know the basic things, or they are studying for other post-graduation, their basics are clear. Some cases maybe already 40% they are advanced. Yes, in that case, if without job and everything, 2 to 3 months, but it's really near impossible. So if somebody is giving status in your Facebook or telling you that I have passed after reading after 2 to 3 months, they are liar. Just a simple diagnosis of them, of their disease. Okay, so they're lying. Okay, this is the thing. So it's not possible. So now let's come. What is our discussion topic today? So regarding the courses. So usually what thing I am following now, everything need a structure and I love everything to be in a structure. So the courses I have made actually, these are within a structure. Okay. So I have actually 3 courses for this. Just let me write here. So what are the courses? There are a first time one read, that is the power batch. This is we are taking like 4 to 4.5 months. Okay. So within this time, first read you will finish. We are trying to read out the first time, all the topics along with at least minimum 1 question bank. This is the minimum. If somebody has enough time, I'm advising always go for the 2, at least 2. 2 is enough. No need to go for 3 question banks. Unnecessary. You are just killing your time, wasting your time, making your brain more haphazard. So 2 whoever done 2, they, if by understanding, not by just reading, okay, then they are sure to pass, if Allah wants, of course. Okay. So this is the power batch that we will have our full syllabus done first time. Okay. This is one batch I have. Another batch they are having after finishing this power, then I'm starting to revise. That is the rapid revision. Okay. How I'm going to do the rapid revision, I will also tell. I will elaborate. Just have a concise form of the courses first. Okay. So this is about 4 months and this is about 3+ months, minimum 3 months. So these 2 courses, if somebody wants to be with me with the course from starting of this power and till the exam date, they have another course, that is that regular one. This is the regular one. This is the full 7+ months. That means it will start with the power batch. They will have everything that the power batch people are getting. And also they will have everything that rapid revision batch will be getting. And yeah, I'm coming to the question, inshallah, Dr. Ovais. Give me, I will open the floor for all of you, inshallah. Okay, dear? Just let me finish the topics, that otherwise I will be away from the topics. Okay, dear? I will answer it, inshallah. Any question that if I know the answer, I will answer, inshallah. Okay. So just give me time. Okay, just give me 20 minutes, I will finish. So this is the 7 months course. Then they are starting from the power batch until the exam date. So let me just show you the way. This is our website. If you click, it will come like this. Okay. So this is our website. You see there are everything. If you want to choose MRCP part 1 January, the January all courses will be shown in your screen. Okay, dear. So now let's see the regular batch, which is the 7+ months. That means from first to last, you will be with me. So just have a look at this, how I'm organizing this. Okay. So this already actually we have started. We have started from the June. This is the July. We have already done some. So this is live plus recorded. So weekly, usually 1 or 2 classes live I'm taking. Otherwise, the recorded sessions of all topics are there. So this is the routine. This is the specified routine. Weekly, every single chapter I'm taking, we're trying to finishing. If somebody is lagging behind, I'm telling them with the small or short chapter to finish it. Okay, so the June, we have already done our hematology. If you can see, look at the June month, the month 1. I have done the we have done hematology. Then after 1 week, we are having every Sunday, we are having a mock test. That is the hematology mock. Then we have our cardiology week. Again, Sunday is the cardiology mock test. So the whole week, you have time to study and time to solve the question, prepare for 1 chapter. And on Sunday, you are going for the mock test. So like this, so this week is going on with our neurology. So only 2 chapters we have done. Neurology also actually all lectures been uploaded. If you go down, you will see we have done cardiology. See, cardiology, there are already almost like 5.5 hours, almost like 5.5 hours plus 3, 4, 5, yeah, 6, sorry, 6 hours plus lectures are already being uploaded. Okay, this is locked. If you are already enrolled, if you press this, it will be open for you. Any lecture, it will be opened for you. And you can listen to the lectures till your exam date. It will be open for you. Even somebody enrolled today, they can open the cardiology and hematology. You see, hematology also, there are so many lectures. This is, Alhamdulillah, I'm trying to cover all the topics that MRCP part 1 usually having regular questions. Okay, unusual 20 question, nobody in the world can give you. Okay, so yes, all the usual question I'm giving in this power batch, usual question topic, the topics with very clarifying basics, with very good explanation I'm trying to give. I don't know if the participants can tell that how is the lecture, how they're adopting, but I'm giving my best anyway. So this is the way neurology this week is going on. And this next Sunday, we are having our next neurology mock test. So they are preparing, who are already enrolled, they are preparing for neurology for the mock test. This is the one. So neurology already all lectures uploaded. So these all lectures will be opened for regular batch till the January exam date. So whenever you feel that I forgot one topic, one thing from hematology, you just guys can go to that hematology and can listen to the same lecture. You can just speed it up, whatever part you want to do, you can do. Okay. So this is the way the lectures are taking. So the lectures, how I'm taking the lectures, if you are going to my website, you can see some demo are there. They are free demo. Anything, if you click any course, there will be a free demo. Okay, so see, this is the free demo, the blue one. If you start learning like that, so you will have some demonstration that is freely uploaded already. So you will have the idea how usually I'm teaching. Okay, so this is for a clarification that how I'm teaching. Okay, now come, people are asking me some other question. So what is the question? Just a minute. So different kind of courses I have told you. How the courses are I'm conducting, I have told you. Lectures, notes, and exam, I have told you. Notes, regarding notes, people are asking me if I'm providing any notes. No, no, this is a simple negative answer from me. I'm not writing any book. I'm not a writer. Okay. And there are so many resources for part 1 MRCP. Okay. So what I do, I'm selecting specifically 2 books, and that I'm usually following in my lectures. And already these all PDFs I have already delivered to all my fellow doctors, whoever in my group. These are all notes are free, dear. All notes are free. Whatever notes you want in the world, even in Google you search, you will get it free. So don't, if somebody asks you for payment for any lecture sheet, please, that will be a very good advice if you take it. Don't go for that. Don't waste your money. For lectures, a lecture cannot make you pass because there are already so many lectures, so many resources are there. Okay, so you need to know what you should pick it up from there, and which things are important, how the questions are coming. And that is what I'm doing in my lectures, that I'm explaining the fact, like myocardial infarction. Okay, so I'm explaining first the thing, the theoretical part, that what you should know about it, and then explaining that how the questions are coming, what are the questions that I have come across, the usual one. Again and again, I'm telling the regular questions, I'm talking all here in Power Batch. Okay, what about some other unusual question? Unusual question there you will find in every chapter on exam or past test, whoever will try to do, you will get maybe 20 or maybe some chapters even 30 to 35 plus questions are unusual. That is totally unusual, and you need to know about that topic very little, maybe 1 line or 2 line things. Okay, so what about those unusual things? Because I told you that I am preferring 1 or 2 question banks. So you don't have time to go through all these question banks. That is what I'm doing in my rapid revision course. What I'm doing? In rapid revision course, I'm not taking in elaborate anything, because already the regular batch or the power batch, they know. I am confident enough that they know everything about the concept. Okay. So in rapid revision, I am doing a rapidly revision of topics and specifically uttering the unusual question that I have a note I did when I solved myself the on exam and past test, because I'm advising always to do the past medicine. So past medicine, all of you already know. So just remaining what? Remaining. So there are actually question banks. If you are asking me, past medicine, past test, these are the question bank. Okay, dear? That is the popular one for MRCP part 1. I don't know, on exam or BMJ, some people are telling. Okay. So obviously, my first advice always to do past medicine. Without solving past medicine, don't even, have the courage. Don't you dare to register for your part 1. Please don't do that. Okay. Maybe luckily you will part 1, part 2, you will be caught. Okay. So past medicine solving, this is your must do things. So one question bank I'm telling must to do. So what about the other 2? If you have time, go for past test. I love past test better than the on exam. Okay. But if you don't have time, don't worry. Rapid revision courses, usually the unusual question, which I know that it is a new topic for you. It is a new kind of twisted. Some questions are twisted, complicated. That questions I'm uttering, I'm explaining, I'm discussing. This is what I am doing in my rapid revision course. Plus, what I'm doing, I'm trying to solve. People are asking me if I'm doing any past paper solving batch or not. No, I don't have exactly past paper solving batch. But yes, I do solve some question. I did solve some questions in some free sessions. So these solution classes are being uploaded in the rapid revision for a time being, to make them watch it. And then I'm removing that. Okay, to have an idea, So how many questions usually you will get from past paper solving? So it will be like 100 to 200 or more than that. I'm telling you always the minimum, because if I'm promising something, if I cannot do, that will be a very bad thing and I don't want. Okay, so I will give you whatever I'm doing, the honest thing, the honest opinion and honest thing to do. This is the thing. Okay, because I'm a mentor, so I should be very clear that what I'm doing. Okay, otherwise why should you come to me? Okay, the respect line should be there. Okay, so yes, there will be 100 plus or 200. Yeah, it could be before ultimately before the exam, it could be reached the 100, but it will obviously 100 plus question. You will get the idea that how usually you should solve, how you should solve. This is the thing. And the number will be increasing day by day, maybe, because the questions already I saw that will be recorded and the next one will be there. So yes, maybe the next diet people will get more questions solved in there. So this is the thing for rapid revision. Okay, dear. So come with our rapid revision. I already discussed. Following a routine, I showed you the routine, how I am going on. Question banks, I already told you what are the question banks, what you should follow. Course subscription starting and ending day, every detail. Please read through whatever it is in the website before subscribing my course. Okay, dear? Because you should have a very, very, water crystal-like clear picture that what you are subscribing for. Okay, so read through that and try to understand the starting day, ending day, how it is running. And please try to watch any demonstration, even only one, before subscription. Okay, just don't go with my words. First, watch the video. And if you find it, yeah, it will be helpful for you, then only subscribe. Other than that, please don't do that. Okay, without mentor, people are even passing. And it is true. Not everyone need mentor. Okay, people when need mentor, if they cannot be in a track, if they want to be in a track, if they want to do it in a very precise, concise time, because whatever you will gain in a next 8 months or 10 months, that already I have gone through. So I can give you the in a nutshell, in a very short time, a very clear conception, which maybe you will need more time to get. But if you have more time, and you don't want to go for any mentor, that is totally okay. That is totally okay. It's not like that you cannot pass without any mentor. You can do that, dear. You can do that, okay? But if you need to be in a track, and if you want to utilize the timing, and in a very short time being, you want your preparation to be perfect, then yes, you can go for any mentor you like, okay? So this is the thing. Continuous enrollment availability. So if somebody is with me, obviously till the exam, it will be there, and I'm always available with a mentor's special chat group. So what is mentor's special chat group? For each diet, Like I have one WhatsApp group for this August people who are appearing, another one for October people who are enrolled. That is totally different. That is not the generalized group that already I think you people are all in. So I have a special group who are already subscribed with me, who are enrolled. Okay. So with them, I have a special group, and there, if anyone having any problem, they can ask me freely. And for them, always I'm there. Okay. So even any personal, any query, if there are some people are feeling shy, embarrassed to ask question in a group. So for them, yeah, I'm always available, because I don't, whoever already with me, obviously it is my duty to serve him with or her that with a very clear concept that I have promised. Okay. So I try to maintain that. Okay. So this is the special chat or WhatsApp group mentioned about. So this is the whole thing about all the courses. So from my side, the demonstration is finished. Now the floor is open for you all. If any question, you can ask me, you can write me, no problem, dear. So I have already a question, I think. Let me answer this first. So Dr. Weiss, you asked me, sorry to interrupt, if some doctor failed by only 15 to 20 marks, I think for him possible to pass within 3 months, more than enough for him? Yes, yes, because he already appeared. Okay, dear. So if some doctor already has appeared and just by few marks, and I'm sorry to say 15 to 20 marks is not a few marks actually, it's a big mark. It's a big mark. People are even failing for 1 mark. Trust me, even 1 mark, 2 mark, they're failing. Okay, dear. So 15 to 20, it is not a biggest marks gap or not a small mark gaps. Okay. So the gap is like medium. I mean, he needs revision more. He or she needs to revise it more, to recapitulate more, and he or she should go for the number distribution that already, because anybody who has already appeared, this is another advice. There is a mark sheet provided to your personalized mail by RCP. Okay, there is a distribution that cardiovascular, how much percentage you got, then clinical, how much percentage you got, CNS, how much percentage you got. So try to evaluate by yourself which chapter you have actually had that deficiency or weakness. Try to recover it first. Then the first 1 month maybe you will give to recover the lower marks chapters, and then next 2 months you will try to revise. You'll try to revise. Revision is the best key, the last key, last resort for passing of MRCP, dear. Even if you're studying more and more and more, but you didn't revise, you didn't make it in a nutshell, you didn't box it, you didn't wrap it. If so, there are so many gifts you are collecting. So if you are not organized it in a box, you are a failure. Trust me, in the exam hall, you will not remember, you will even forget the easiest thing because you were running after the critical things. This is another thing. Okay. Another advice before going to the next question. Before the exam, if any August examinee is there, or if you are listening to me with the record, before 1 month, of your exam date, please don't do any new topic or question. Okay. You will find people in every group, Facebook group, Telegram group, WhatsApp group. I know you all are already part of so many groups. I know this because I was also in your, I already walked your pathway, right? So I was also part of so many groups. And what some people are doing, what they are doing, before 1 month, they start to posting so many difficult questions. And your confidence level will be low. Trust me. You will find out, oh no, I don't know it. What is this? My dear, these difficult questions are very low in percentage in your exam hall. Okay. So don't run behind those difficult questions. You will forget the easier one. The easier thing you will forget. Trust me, I know people who are running behind difficult questions for this 1 month just before the exam, and they are doing all the simple thing wrong in the exam, and they're failing. So before 1 month, actually, Even you should stop the WhatsApp unnecessary group. Because if you have 15 groups and 15 groups are starting to post even 2 questions, you have 30 questions to read in one day before your exam. Very, 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 very wasting of time of your days before exam. Don't ever do that. So stop going before any new question, any new topic before 1 month. Whatever you have read, it's done. It's done. Okay, dear? So this is another golden advice. So I think somebody asked me something. Is there any way to know if I'm ready? Not, I mean, a test to do? Yes, dear, Dr. Burhan, there is a way. There is a way. That is called the past paper. Okay. These past papers are similar to the questions of RCP. So go for these papers. If you are getting like 65% up, there is a high chance. I mean, there is a chance, not high. There is a chance you will get pass. Your preparation is okay. Okay. If the number is increasing, your percentage of preparation, that means you are getting better. Okay. So choose any past paper, but try to choose the recent years, recent 3 to 5 years. Don't go very back, because so many guidelines have changed. And maybe if you are not aware of, you will get the wrong information from there. Okay. So that is why I'm telling. So recent things, even 3 years questions is enough. 3 years, 4 diets, it's almost like 12 questions. So it's okay. It's okay. 12 to 15 questions paper solving before exam. It is okay. It is enough. Okay. If you have more time, you can go for more. Nobody is blocking you. Okay. Another way is there. Another thing, obviously, you should do the RCP sample paper. Every time I'm uttering this before going to the exam hall, this RCP sample paper, you should do at least twice. This is the minimum timing. The explanation of RCP sample paper, it should be at the tip of your tongue. The explanations, because the questions are not coming similarly, but the explanations based questions are coming. The explanations that you will get in the sample paper. Okay. Is there any other question regarding part 1? Any other question, dear? Any question regarding part 1 or regarding my course or regarding your preparation, anything? Feel free to ask, no problem. If you don't want to ask in a general, even you can, you can just message me here. Anything? I think no other message. So I want to finish this. If any no more question, I will end this session. I don't want to make it longer actually, because I want very important advice in a very short time so that people can watch later on. Because very few people, they have told me to upload it in the YouTube. So I want it to be short. If it is the with necessary question, that is enough. Any other question? No? No? Okay. Thank you. Thank you so much, everyone. So we will see you, inshallah, next week. Thank you, Dr. Weiz. Thank you, Dr. Aksaima, Dr. Avid, all of you who have attended. Thank you so much. We will meet you, inshallah, on next Monday, I think. I have declared the date. So I will take a live decision. So maybe I will come with some question solving or maybe topics. Let me decide. I will just announce it in the group. Is past medicine is enough for preparation? Past medicine is enough for preparation, yes, if your concept is clear. So it's not that only you are solving the past medicine question bank and you will go for the exam hall. No, not like that. Along with that, there should be a theory book. It could be your past medicine notes. Okay, the notes. This is the highest priority I'm giving. Along with that, Maghrabi sir's book also very good. Very good, because it is with marked some things and some previous question explanation. So you will feel like you are also doing some question along with every topic. So that's why I love this Maghrabi sir's book and the previous edition, of course. Let me clarify, not the recent one. Recent one, I feel it a little bit lengthy. So for me, I think that the previous one is better for me. So there could be another opinion, but it's my personal opinion, actually. I adore him, mashallah. He's a very good writer. So anyway, thank you anyone. Any other question, or I'm gonna finish it? Okay, thank you so much. So I'm going to end my meeting. See you inshallah. Assalamu alaikum.